Welcome to the Royal Aberdeen Children's Hospital. Where every year...
Option number one is chop it off.
More than 20,000 boys and girls from across the north of Scotland receive life-changing treatment.
Can you hear Mummy's voice, Clara? Oh, wow!
From a dedicated medical team.
It's different from Hobie City and Casualty and what you actually see in the soaps.
Coming up, Corin finds out if her cancer treatment is working.
The ideal news would be that the tumour's completely shrunk and it's gone. Highly unlikely.
A nasty fall leaves Chloe with serious injuries.
It's a fair old shiner, isn't it?
And doctors try to fix Lewis's nose after a dog bite.
She's never had any surgery or been in hospital or anything like that before, so it's a bit worrying.
This is the Children's Hospital.
I'll require some staff next weekend.
The medical ward treats children who require specialist drugs and medications. 6-year-old Corin and her mum Rona have spent a lot of time on this ward. 4.5 months ago, Corin was diagnosed with high-risk neuroblastoma, a rare type of cancer.
Her main tumour is in her chest, and it's around her spine. But she also has in her lymph nodes and her bones down at the hips as well. That is moved from the initial tumour site into different places in the body.
Corin has been treated with intensive chemotherapy to try and shrink the cancer and stop it from spreading.
Her type of cancer, it's quite intense, aggressive treatment, kind of jam-packed into a short period, so she's been through a lot.
Does it have a name?
It's scary.
Today, Corin will be having a special scan which will show if the chemo has worked.
To me, any change is a good change, so if it's been a large shrinkage, it's brilliant. If it's a small shrinkage, it's still brilliant. So we just keep doing it as the day goes. So.
Corin is anaesthetised to keep her as still as possible during the scan. Then she's taken down to the nuclear medicine department.
Are we able to get a hand to transfer? Would that be all right? Fine. Everybody ready?
Yes.
Corin has been injected with a radioactive dye which binds to the surface of tumours.
That'll be about 15 minutes.
During the scan, gamma cameras detect radiation from the dye, which highlights the location and size of any tumours in Corin's body.
This part is just holding the two cameras. There's one camera above the patient and one below, and they slowly move around the patient, taking a 3D image. The patient needs to be very still, otherwise you just get a blurred image.
Today's scan will show whether Corin's tumour has shrunk enough to be removed surgically.
Okay, and that's us finished.
Yep, thank you.
Oh, thank you very much.
Bye-bye.
So we've got some good quality images. We just need to do some processing on the images now, and then that'll be ready for the radiologist to do the report.
After the scan, Corin starts to wake up from the anaesthetic.
Never know how she's going to react, so today is quite a good reaction.
And before she goes home, there's time for a quick visit from Lisa Lollipop.
That's the biggest ball of snow.
Yeah. Getting a snowman on my arm.
Can you tell me when to stop?
No.
Stop? Yeah.
Oh, it's cool!
You're finished now. And is Mum having any snowflakes?
No, it's not.
You said ta-ta, Lisa. Bye. We'll see you soon.
I like it. Just the one.
Corin and Rona will have to wait 7 days for the results of the scan. Another regular visitor to the Children's Hospital is Sebastian. He was born with a condition called talipes, more commonly known as clubfoot. He started corrective treatment when he was only 3 weeks old.
It's a condition that affects the foot and ankle, so the foot's pointing inwards and downwards as well.
At 3 months old, he underwent a tenotomy, an operation to cut his Achilles tendon.
So it's just a wee nick, you feel it ping up, and then we'll put it in that position.
Today, Sebastian has returned to the hospital for an assessment.
Really happy with his feet, pleased with how he's getting on. You call the shots, don't you? Yes, you do. You're the boss.
Physiotherapist Roz has been treating Sebastian since he was a tiny baby.
It's a routine check, just to check how his feet are doing, but he might be walking. So he will attend every 3 months, and then once he's walking, he will then attend every 6 months. So his walking today doesn't need to come back for 6 months.
Hello, Sebastian. Hello, are you going to come and see this lovely room of toys?
We're going to see some toys.
Come on then.
Come on then.
Come on.
What's this?
There we go. So he's obviously sitting on his own, pulling himself up to stand yet.
He can't. He's trying.
He's trying. Oh, I can feel him pulling. I can feel him pulling.
Yeah, he's an extremely efficient bum shuffler,
Yeah.
so...
And once they've got a speedy way of moving around, it often takes a little while because why?
I know.
Sebastian is now 15 months old and should soon be walking. The treatment for his talipes shouldn't be holding him back, but Roz wants to make sure his feet and legs are developing properly.
So he's kicking
Oh, yeah.
both legs equally. So have you any concerns at all about the position of his feet?
I mean, when he's sitting down, you can see him pulling his foot round, so he's still pulling it in.
Okay.
But I don't have any concerns that way.
Go and show us how you move then. Let's see him how you move. How are you moving? And once we see you standing, we'll know your feet are doing just great.
Sebastian may not be walking quite yet, but it's not stopping him from getting around.
Get him.
Go on then. Is there some food there? You can go. Go and have a look. Go and see. Yeah, the oven door.
Look. Oh, look. Good boy. Good boy.
Wow.
Yay! There we go, he's standing.
That's the best I've seen.
Yay! He's totally, I'm not going to let him go obviously, but he's absolutely solid there. Those legs are strong enough. Good boy, that was very clever.
Good.
No, that was good. That was good to see him standing up.
It's encouraging to hear from Roz that she thinks he is interested in standing up. They say that talipes doesn't prevent them from reaching their milestones, but when he's not standing at this age, he does start to sort of niggle at you a little bit, but he's definitely getting there.
Perfect, right, come on, we'll try and see if these boots fit you, will we?
To ensure Sebastian's foot stays in the correct position, he has to wear special boots for 12 hours every night.
There we go, check his little heels down.
Yeah.
His feet are perfect. Couldn't look better. So if we can check there where the position of his toes are, they're fairly even side to side.
I mean, his left is a little bit
yeah,
smaller,
but nothing,
not significant.
Definitely not significant.
Click, click.
Click, click.
The boots are joined together by a metal bar, which can be adjusted as Sebastian grows.
And you can see there that holds, that's better now.
Are you ready?
Sebastian will be wearing the boots and bar throughout the night until he's around 5 years old.
Ultimately, he needs these boots and bar on. Without the boots and bar on, there's a high chance that his foot position would go back to, or not, to either the way it was or certainly towards the way it was when he was born. So the boots and bar are absolutely vital. We'll see him again in 3 months.
Great.
All right.
Thank you, Rose.
On the medical ward, Corin has returned.
Imagine.
Chemotherapy can attack blood cells and platelets, leaving Corin prone to infection. So twice a week, she comes into the hospital for blood tests.
She's had quite a few platelets transfusions. If they go below 20, she will get a transfusion of platelets because then you're at risk of internal bleeding, etc. But she also gets blood transfusions as well.
Take syringes and take it out real quick, please.
You okay today, chum? Yeah.
Nurse Rachel takes blood from a line which is connected to a large vein in Corin's chest. Corin calls it her wiggly.
What are you doing the rest of today? Doing anything nice?
Sure.
What are you going to buy? Sparkly things. You like your sparkles, do you?
Not Disney.
No. Disney! Oh my goodness. Well done. You're very, very brave. Perfect. Enjoy your shopping.
So we'll need to stay in Aberdeen just in case she needs to come back for a transfusion. So we'll just nip into town. For the actual sample to go to the lab, only really need about 1 ml. I'll have to contact the porter to take them away. H for haematology.
A porter takes Corin's blood sample to the haematology lab, where medical laboratory assistant Billy starts to process Corin's sample. Open 24/7, 365 days a year, the haematology lab processes up to 3,000 blood samples each day from across the northeast.
It's a paediatric sample, a child sample, and they come in these specially pink-coloured tops.
Corin's blood sample is taken into the analyzer.
It comes along and draws the sample through all these little units here.
The analyzer uses lasers to assess the properties of the blood.
And now it's been drawn through what we call flow cells, counts all the different red cells, all the different white cells, and then transmits the results across. It's the chemistry. Chemistry is magic.
3 robots, 4 analyzers and an automated track helps the lab staff turn around 98.5% of samples within an hour.
That's her sample sampled. It'll now come back out where the screener can pick it up and check the sample.
Okay, so you can see it's an oncology patient from Sick Kids Medical.
The screeners check the results before they're sent back to the ward.
So we can just sign this one out actually, yeah, authorise it. There we go.
After a quick shopping trip in town, Corin and Rona return to the medical ward for the results.
Okay, so today's bloods are looking good. Hemoglobin is 96, her platelets are 92, white blood count's 7 and neutrophils are 5.3.
So they've shot up?
All good, yeah. Hemoglobin's dropped a little bit, but nothing that we would worry about at the moment, kind of, but yeah, all good.
Perfect.
Okay, and we shall see you Monday.
It just means that she's starting to recover a lot quicker than I thought she would, so yeah, it's very good. Very good. Yep. Brilliant.
You're dancing. Right, okay, enjoy your weekend. We shall see you later.
Corin will return to the hospital in 3 days. The emergency department is one of the busiest areas in the children's hospital. Around 17,000 patients come in each year. 1-year-old Chloe has been rushed in after falling 5 feet from a bunk bed, hitting her head and eye. Big sister Sophie was with her when she fell.
My little sister fell down the bed and on the top bunk. It's almost all the way to the top. I will show you. Look. It's my big sister. Look at her eye.
Severe head injuries are one of the most common causes of disability and death in children. Symptoms can include loss of consciousness and bleeding from the ears or nose.
Did she cry immediately that you're aware of? So there's not been any loss of consciousness or anything?
She couldn't stand up, so she was like kind of dizzy and like.
Okay.
It was like a big bang.
A big bang, okay. Did you see your sister fall?
Yeah.
And what has she landed on when she's hit the floor? Has there been any... The lamp. Is there a lamp on the floor? There is a lamp on the floor, okay.
Nurse Angela starts to assess Chloe's injuries, checking for pain and numbness in her limbs.
She's not crying or anything, she's using her arms. That's okay.
Angela has ruled out any broken limbs, but Chloe has bruises and swelling to her eye and head.
Mum, she's not been sick or anything?
She's got blood from her nose.
Blood from her nose, okay. Now, can we have a look in your eyes? That's it. I don't think I'm going to see much in this one, are we? Okay, darling, can you look up for me? That's perfect. Apart from obviously the obvious facial, is there any other concerns you have?
Well, I was worried that she wouldn't be any bleeding on inside or concussion, obviously.
Something red here as well.
Oh dear. Yeah. Is that sore? Is that one sore too? I know, darling.
It was worrying, you know, to see her like that. And they were both in hysterics. It's not a nice feeling at all.
So we'll pop you into a wee room. We'll let the doctors know the story, will we? And you can tell them the story because you were there, weren't you? Yeah? And then they'll come and tell you what to do from there.
Initial assessment complete, Chloe now has to wait to see a doctor. Next door, 4-year-old Lois is also waiting for a doctor. She's been bitten on the face by her grand's dog. More than 4,000 people are hospitalised in Scotland each year due to dog attacks, and many are young children.
She was cuddling into him, and he's about 80% blind anyway, so he must have gotten a bit of a scare and lashed out on Lois. Whether he bit her or his claw caught her on her nose, I don't know. So unfortunately we've ended up in here.
The side of Lois's nose is cut through and her lip is swollen.
Hello.
Junior Dr. Chris comes to have a look.
How are you doing? I like your slippers. My name's Chris. I'm one of the doctors here. How are you doing? Well, so I am an expert on noses. And I can see you have got a nose. So do you mind if I have a wee look?
You doctor, have a looky.
I'm not going to touch you.
Just have a wee look.
Just a wee light here, see?
A little light. Wow. Yeah? Right, doctor, have a wee look. I'll take it all.
Yeah, so it seems to be just relatively straight through there. Do you think it was a bite or a claw or?
I'm not 100% sure.
Graze there.
Yeah.
So it's obviously cut through in the front part of the front of the nostril, and then it seems to go more superficial at the back. So, so functionally, it's all fine. But that might need a wee stitch on it.
Okay.
So for things relating to suturing in the skin, usually we might get the plastics team to have a wee look. You just had a wee shock, haven't you? Nice to meet you both.
Okay, thanks.
Thank you. It's unclear if it's a bite or a claw, but she's fortunately fine, a wee bit shocked. But the question is how deep is the cut and whether or not it needs fixed with a suture. Certainly it'll heal up itself, we just need to do the best we can for this little girl's face.
As a mum, when you get the phone call, what goes through your mind?
Oh, just panic. You just want to see her and make sure she was okay. She's not responding at all, she's not saying anything, so we're just waiting to find out what the next step is.
While Lois waits on the plastic surgery team,
Hello. Hello.
emergency medicine registrar Ben comes to assess Chloe's head injury.
Let's have a quick look at you, shall we, lovely? Oh, I mean, it's a fair old shiner, isn't it? Oh. I know.
The bump on Chloe's head had a bit of a soft centre, so that's one of the signs we look for potentially being a sign of a skull fracture, and could also have a little injury to the brain underneath it. to, we'll take you through to the ward across the way, our paediatric assessment unit.
You got everything, yeah? Yeah, so if you just follow me. Okay.
Chloe will spend the night under observation and will have scans if any concerns arise. The plastics team have added Lois to tomorrow's emergency surgery list.
She's never had any surgery or been in hospital or anything like that before, so it's a bit worrying because she doesn't know what's happening. Go with what's best.
They're the experts. They're the experts, aren't they?
Back tomorrow it is. Just fingers crossed everything goes to plan.
You hold my hand. Let's go. Come back in the morning. Say bye-bye.
Bye-bye.
Say bye-bye.
In the middle of the night, due to ongoing concerns, Chloe was taken for a CT scan of her brain.
We have scanned, so about 1 a.m. So she had scan. And we are worried about her blood inside head.
It revealed a fracture to her skull.
Just a crack here. I'm going home, yeah!
The fracture should heal on its own, but the neurosurgical team will assess it in 6 weeks' time. Upstairs in theatre, Lois has already been anaesthetised, and plastic surgeon Mr. Rahman and registrar Bismarck are preparing for surgery to repair her nose.
So you can see actually, it's kind of what I was expecting, it is hanging down. During my on-call week, I usually get to see at least 1 or 2 dog bites and cat bites as well, and it's surprising how often we see them in both adults and children. So we can quilt it, a couple of 6-0s in there, that quilts it down, and then you can use the A-toe nicely on the outside.
Bismarck is using a really fine suture thread to hold the edges of the wound together. Surgical loops on his glasses magnify the area, but it's still a very delicate procedure.
Just waiting patiently to hear. Quite nervous because they said an hour and it's over an hour, so we're... She's my baby and just a worry. But this waiting is just...
It's the worst bit.
Yeah, come on. We just want to see her, make sure she's okay.
Well, I would stitch down the inside as well, because it was a proper U-shaped flap, wasn't it?
I'll stitch maybe, I'll put a few stitches on.
You'll need a few, yeah. The inside, if you're struggling with the A-toe, I don't mind you going for a thicker stitch because it's less obvious, but the outside has to be with the...
And then I'll put maybe one around here to secure.
Okay.
Lois's nostril is stitched inside and out. On the outside, the superfine delicate suture should leave no visible scar. Once the stitching is complete, Mr. Rahman applies a special glue which will keep the wound closed and act as a barrier against infections.
It was a small wound, but it was in a potentially disfiguring area. But I have seen some quite awful ones over my time here, and it does happen. And it just takes a pet to be cranky for a second, and that's what happened in this instance, and the wee kid got lashed out on.
After the operation, Lois goes to the day case unit.
She's back the road to recovery, I think, more herself. So it's a big relief, big relief.
Tired but delighted.
A week after Corin's scan, she's come for the results.
Fingers crossed, it's good news.
How are you feeling?
I'm a bit nervous. I just have to wait and see what Dr. Bishop says. The ideal news would be that the tumour's completely shrunk and it's gone. Highly unlikely. So the next level would be that the tumour is shrunk enough and is in a viable position for it to be operated on to get it cut out. Because of the placement of the tumour, it's quite risky, but you just need to weigh up what's best for the future outcome.
So a lot of responsibility there.
Yes. Yeah. Quite scary.
Corin has brought her big brother Rowan and dad Paul with her today. Paediatric oncologist Dr. Bishop will be giving the results.
How are you doing? Excellent. You feeling well? Good, good, good. So, you had a few scans done over the last couple of weeks and a few other tests, so we're just going to talk through the results of those. So I don't have any bad news for you, so that's the first thing to say. Okay, so we'll just get that anxiety out of the way. The one with the radioactive dye and then the scan which we had done the other day. And that still shows a little bit of uptake in the primary tumour in the chest, which is expected, and it doesn't show any uptake anywhere else in the body. Okay, so that's good as well. So they're doing what they're supposed to do.
The cancer, which had spread around Corin's body, has gone, but the primary tumour remains in her chest.
We know that the tumour had shrunk a huge amount with the initial chemotherapy. What's left behind is what needs to be removed at an operation. Okay, so you're doing brilliant. How are you feeling? Yeah? Again, you want to ask? You sure? We've just got a few more things to do to finish off making you all better. Okay?
Thank you very much.
Okay, take care. See you later. Bye-bye.
All good news. So it's put a little bit of the nerves at rest. Still nervous about the operation itself, but if the surgeon says it's okay to go, he's the specialist in Scotland, so I've got my full faith in them, and hopefully this next step will be able for us to look forward a little bit more and just keep looking for that positive outcome.
Come on, Hook. You go here. Okay.